says preparing to live stream. We've got a little bit of a delay.
Summer, nice job navigating all this. I would be sweating it.
Oh, there's a little sweat going on. Okay, we're live there and I'm starting the recording. You're set.
Thank you so much. We are together here for our regular city council meeting on April 28th, 2020. It is 7:07 p.m. I'll call this meeting to order. And Summer, could you please roll call vote all of those that are with us today?
I will. We have Lori Simonson, City Attorney, Ronnie Darasari, Moab City Council, Carly Castle, Assistant City Manager, Joel Linares, City Manager, Kaylin Jones, Moab City Council, Clint York, Finance Director, Mike Duncan, Moab City Council, Tawny Knutson Boyd, Moab City Council. Did I lose Ronnie? Or did I say her? I think that's it. And then just for when we get to that point, when we have the others enter the meeting, we will have Braden Bradford from Southeastern Utah Health Department, Jennifer Sadoff from Moab Regional Hospital, and Dr. Dylan Cole from Moab Regional Hospital.
And with the blessing of this council, I'd like to actually invite them to join us now and provide some COVID-19 updates to us now. I thought it would be easier for them to join us on the hour as opposed to waiting for our reports. So we can go ahead and bring them out of the waiting room, and it's fine to have all three of them with us together. But I was hoping that Brady would start first with some updates from the Health Department. Welcome, and thank you for joining us tonight for our meeting.
I appreciate the invitation, and I'm happy to be here. Everyone pretty well knows that our case count in Grand County has been very low. In fact, kind of perplexingly, it's been low throughout most of rural Utah, particularly eastern Utah, if you can include the Uinta Basin, and then through central Utah. But we do expect to see those numbers increase. If you check out the state website and if you check out our website, you will oftentimes see differing numbers. That is because we do count individuals that may be from out of town that we have quarantined or isolated, that the state does not count. Those are automatically sent to their home state or location. Likewise, we may test positive some individuals that are from Salt Lake or the Wasatch Front that immediately return home. We won't count those cases locally if they have returned to their place of residence. But of more interest, I think, is where we are going in terms of orders. And in that note, I don't know how many of you received an update from either League of Cities and Towns, or I don't know how connected you might be to Utah Association of Counties. But in Governor Herbert's press conference today, he officially accepted the recommendations to go to orange, and he does plan on making the adoption of that that guidance an executive order that will begin at 12:01 on May 1st. We expect to see language to that regard tomorrow. And so there are still some elements of that order that we're a little bit unclear of about. What will that mean for face coverings, for example? That's something that we've received a lot of feedback for as we look to repeal some of the restrictions that have been in place in Grand County and throughout Utah. But a lot of people are anxious to see face coverings a mandatory requirement. We have received instruction that anything that varies from the guidance that falls under the orange level has to receive approval from the governor or the Economic and Public Health Commission. They have our proposed lodging guidance for the next, that would be in place for the next couple of weeks. They can choose to accept all of that guidance, which opens up camp. I hope that you've had a chance to see that. If not, I can send it out. But campgrounds and RV parks at 50%. Short-term rentals are all open, but they must wait 72 hours between bookings. Hotels have kind of a graduated booking schedule. All of that with the intent of just limiting the initial wave of visitors to Grand County so that we can see how that affects the local employees, how that affects our testing, how that affects our positivity rate. I kind of lost myself there for a second. So they have that in place. They can accept all of that. They can accept part of that, or they may choose to reject it. I expect to find out more tomorrow. I wish I had it now, but this has all been in the last couple of hours that we've received this information. From here, I expect them to at least accept a part of those recommendations. Otherwise, it becomes the responsibility of a business to demonstrate that they can meet the social distancing guidelines that are enumerated in that document. And as they demonstrate that ability or attest that they can do that, we don't know exactly if they'll be required to sign something saying I can do this, or if they will just move ahead. They have the opportunity to be open. There are a number of businesses where that will be challenging in Grand County, is when we think about river trips and shuttle services and things of that nature. But as of now, the onus is upon them to devise a way to maintain the 6 feet, wear face coverings when they're in close contact with the public, and clean between uses and such things as that. So what the governor does will have an effect on the rule that we put out. For the most part, it will say we also adopt the orange level with some exceptions for lodging if they allow that variance. And that would take place at 12:01 on May 1st as well. A lot of the other stuff that's exciting, I think I'll leave to the hospital. It has to do with some testing that they are spearheading. We're kind of behind them in that, but a lot of that's been their drive, and we're excited about it. But I'm hoping that I answered some questions, but I'm willing to take any more that you might have.
Council, do you have any questions for Brady at this time?
Mayor, I have a bunch of questions, but do you want us to wait until the hospital speaks and then whoever it's appropriate for can answer?
We could do that, sure. Especially if your questions kind of overlap.
I'm happy to wait until they've presented.
Okay, well, welcome Jen and Dr. Cole.
Thank you all so much for having us. We really appreciate the opportunity to come and give you an update. It's important to us that we're keeping everybody in the loop of what's going on at Moab Regional Hospital. And a lot of people have reached out to us asking us our opinion on the reopening. And I think that our health department has done a great job in coming up with a mitigation strategy to try and do a soft reopening versus a hard one. We are definitely really hopeful that the governor accepts what has been proposed. And I don't know that we have strong, we haven't thought too much about if the governor doesn't accept it. We're mostly in support of opening with the health department's proposed plan. So I have some points. Ronnie saw them today, and I'll just kind of go through them of why we feel some comfort with the plan that's been proposed. I think nobody feels 100% comfortable because it's unknown territory and it's a little bit scary. And I don't think any of us want to take one step forward and then two steps back. But I think we all need to go into this thinking that that's a possibility, that we'll take a step forward and we'll see a surge and then need to take a step back. So a few key things that have changed, and Dr. Cole, I'll invite you to jump in anytime too. But one major difference between right now and where we were 6 weeks ago is the availability of testing. We can test anybody with even one symptom, and the list of symptoms is broad. It's essentially, if you're not feeling 100%, get tested. So Brady, I hope that's okay to say, but we're really encouraging anybody who doesn't feel good to get tested. We also now have the availability to do antibody testing. And so we'll be able to see if there are people who indeed were exposed a while back when the PCR testing wasn't available. So that will give us that'll give us more information to know really where we're at as a community. Our wish around testing would be that we would have rapid on-site testing. We have a very limited number of rapid on-site tests that'll be used in a pretty strategic way. But we can't really get any more at this point in time because Moab, this region hasn't been hard hit. And so the lab companies are not prioritizing getting us the test kits that we need for rapid on-site testing. Second, and maybe Dr. Cole, I'll pitch this one to you because I really think this is, our medical staff's brainchild is really the screening of high-risk groups and individuals. Do you want to tell them a little bit more about what we'll be doing there?
Absolutely. Yeah. I mean, I think, and thanks again for the invitation to join the meeting tonight. I think to me, the testing conversation, and we will be getting a document out that kind of details and puts in writing, including the definition of what not quite 100% means in terms of all the symptoms that you can get tested for. But we will be getting that document out this week from both the hospital and the health department in terms of a little more of an elaboration of what is our testing strategy. And I think to me, it definitely cannot be said enough that as we move from a time in which widespread social distancing and essentially economic shutdown were the cornerstone of our efforts to mitigate a major surge. And as we move out of that phase into the next phase, it's really important to recognize that widespread testing becomes that cornerstone strategy for how do we figure out, how to mitigate and to contain spread of the virus as best we can. So the testing strategy really, I would say, has kind of three aspects to it. One is widespread testing of community members that are experiencing symptoms. And that is in place now in terms of, people can come in and be tested for even mild symptoms of any of one of about 10 different symptoms or so. Jen spoke to that. The other two things are, that we are working closely with the health department to make sure that we are testing among the contacts of those who are exposed and who test positive, so that that whole classic traditional epidemiology work of tracing contacts, getting in touch with those people who've been exposed, testing among those people, and using testing strategically to allow those people to quarantine when appropriate, but also be able to stay in the workforce when appropriate as well. And then the third group is, we know that because the presentation of this virus can be so wide ranging, from very severe symptoms to minimal symptoms or sometimes asymptomatic, that some type of screening among those that are at high risk of exposure is important as well. And so we have a program, again, kind of a joint program between the hospital and the health department that'll allow us to screen within the individuals who work in high risk settings. I can think of a few examples like healthcare workers, first responders, employees of long-term care facilities. The list goes on, but people who have essential jobs of lots of contact with the public, and as to some extent as the volume of tourism turns back up a little bit, that exposes more and more people to those potentially high-risk settings, whether it's in convenience stores and grocery stores and potentially lodging facilities and such like that. So we'll use our testing capacity to sort of try to kind of rotate through and sample and screen within those high-risk populations as well, even among asymptomatic people, because we know that's a significant route of transmission. There are asymptomatic spreaders of the virus. So those screenings, as we roll that out, will include both for the active phase, for the virus itself. The test is called a PCR or PCR-based test, as well as the antibody testing. I can't help but anytime antibody testing comes up, I have to throw in my caution that the antibody test, a positive antibody test is certainly not yet established that offers or confers any sort of immunity. That's certainly the widespread hope out there in the community, is that there will be some protection that people benefit from once already being exposed to and having recovered from COVID, but it's not yet scientifically shown at all. There's definitely some questions about that. So as far as it goes to affect an individual's decision, the jury's still out on what that antibody means. But in terms of public health and public policy, it's certainly an important piece of being able to understand what the prevalence rate of exposure is in a community, and to track that over time as a function of an immune system response to the virus.
So a few other things in terms of, our comfort level in opening back up. As Dr. Cole mentioned and Brady mentioned, there's good contact tracing, and the health department has assured us that they are adequately staffed and resourced in order to do good contact tracing. In terms of our hospital facilities, we've moved from having 3 rooms really with negative pressure space to having about 23 spots that we've converted into negative pressure spaces to keep patients for a surge. We have the ability to do approximately another 38 or so people in a barracks style setting if we needed to. Our transfer hospitals, St. Mary's Community Hospital, Intermountain Healthcare, and University of Utah have all expressed confidence that they have the ability to receive transfers, that they are trending downwards in hospitalizations, and they too have all ramped up the facilities that they have available. So, it's every hospital is in a very different place than we were 6 weeks ago. And then we also have partnered with the University of Utah to have tele-ICU services at Moab Regional. So if we do get more difficult patients that we need to keep, we'll have the support of University of Utah physicians and nurses on the other side of a computer monitoring the patient, working with our staff to help them with their medical decision-making. And then, I think our county and our community has put in a solid effort to making sure that there are resources in place to assist high-risk individuals with getting groceries, meals, whatever it is. Because I think, and Dr. Cole, you should be really the one who says this, but during this period of reopening, this doesn't mean high risk people should be coming out of their houses and socializing as normal. They should continue to socially distance as they have been. And then, our only big hope is that people won't just, treat this as a green card to resuming activity as normal. They need to continue to be mindful of not spreading the disease, not touching their face, washing their hands. And we would love to see, there will be a lot of people angry for the hospital being comfortable with this opening. There will be a number of people who are angry on the other side that we would love to see masks mandated for use in our community. Socially, it's not acceptable in our culture to be wearing masks. It's uncomfortable. And I remember when I was growing up, seatbelts were not something that anybody used either. Only the really dorky people wore seatbelts, right? Now, when it was made, mandatory to start wearing them, we started culturally doing it. And my child who's making a lot of noise up there, would never think about getting in a car and not buckling her seatbelt. And at some point in time, our culture really should get to the point of, if you're sick or not feeling well, you always wear a mask when you go out. But right now, really everybody needs to be wearing a mask if they're out in public, because it is spread asymptomatically and you don't know if you could make somebody else sick or not. It's wearing a mask is a courteous thing to do at this point in time. And I hate to mandate being courteous, but it might be necessary for people to get to a comfort level of doing something that's unfamiliar. Back me up, Dr. Cole. Everybody will listen if a doctor says it.
Yeah. I think that's a good point, is that, there are cultures and there are societies that have just had a lot of practice. It's something we see, in China, and also, surrounding South Korea and Taiwan, and places that we're seeing on, that went through the experience of COVID early and have managed it overall, fairly successfully, in particular in a couple of those countries. That widespread use of facial coverings definitely is part of that solution. And I think they also, when I say a lot of practice, I mean those societies had the experience of both SARS and MERS to draw from within the last 15 or 20 years. And there's probably some normalization that goes on the more that you encounter and deal with this kind of stuff. And so, yeah, as much as we can support both, I hope that people would do it voluntarily, because it is, I think, a significant thing you can do when you're going to be in close quarters with other people to decrease the transmission risk. So it's really about protecting those around you, not about protecting yourself. But obviously, it's similar to immunization in that case. The more that we can all uptake that, then we can also protect the community as a whole. So.
Can we have super clear clarity for ourselves, for people watching, and just moving forward? The city, the county, and the hospital have not made any kind of mandate or order to wear face masks. The health department would be the organization or agency that would make that mandate. Is that correct? And where are we with that mandate, Brady?
We are one entity that could do that. Other entities could mandate that as well. And it may be a part of the government's or the governor's executive order that we expect to see again tomorrow. That might be a part of it. The guidance right now says that if you cannot socially distance, essentially wear a face covering. To me, that means wear a face covering. That is a requirement, but there's still some nuance there. And that is something we're working with the county attorneys to on potential language moving forward for Grand County.
So as of today, April 28th, there is not a mandate, but there could be tomorrow per the governor's order. a mandate to wear a face covering.
That's correct. If it came from the governor, it would not take effect until Friday morning. But even now, we are considered in the red stage of, high risk, and that's a recommendation or guidance or directive, however you want to put it, that we should be doing that right now. So, and that's a message that should not be new to anyone at this point. Yes, it is a little bit uncomfortable because we're not used to it, but we have been hearing that now for 5, 6, 7 weeks. And I know that's been a practice implemented by a lot of people, but we still see room for improvement.
And how do you and Dr. Cole feel about the bandana approach to face covering? It is having a face mask kind of the preferred, or are people following the guideline by having a bandana or 2 levels of fabric in front of their nose and mouth? What's the position on that one?
My thoughts on that are still that we still are in a situation in which actual medical surgical masks to some extent are hard to come by, and there's still somewhat of a shortage there. So our recommendation would be that cloth alternative face coverings are adequate outside of the medical environment. That's acceptable. Yeah, it would be a cloth face mask would be acceptable.
Okay.
Cloth face covering.
Council, questions from our council? Ronnie, you had a list. You want to start off?
I have a bunch. Some are for me and some are from residents. So I'll just toss them out and I'll try and make them worth your time. First of all, on an email string that I was just happened to be on with Jen Sadoff, this issue came up of the hospital. If you guys had one wish, it would be the city and the county mandating wearing a public mask. So I'm willing to go on the record to say I support that, and I support the county taking up that conversation as well. And you have my support in anything I can do to help the health department and the hospital make that happen. I could go on and on, but I won't. I do think it's interesting that the governor does keep making it up, and people who were listening to him today, he was talking about a mask for every Utah program where people can now go online to the state COVID site /mask and actually get a mask if they don't have one. And so I just wanted to bring that up too. But I know that there are some counties in other states and other places mandating masks. So we can talk more about that later. Some of the questions that I have both for the council and you guys, and I don't know, the health department can jump in as it suits, but part of what's been confusing with the legislature's latest decisions, SB 304, some of the other stuff, is how much local control we still have over these decisions. So, I think we are wondering about things like mandating masks, but also a question a lot of residents are asking me is, what is our plan moving forward? Like, it's great, we're all discussing, we're trying to move forward slowly, and if we have an explosion, we'll move back. But several people have asked me if we have any parameters, specific parameters for that. Like, is somebody working on a set list of number of cases where we would step back, or do we have quantitative metrics for determining when we reinstate more restrictive measures? And then do we have some way to watch what's happening in Colorado and other parts of Utah, just because we know there's going to be an influx here? I have not confirmed, but people tell me there are people on the edges of the county waiting to come in. But we also know our numbers allow us to go to 100% of short-term rentals. I don't have the numbers on all this yet, but we know that's a lot of units. And so we know there could be just a lot of people coming. And I guess people just want some reassurance that there's actually a plan, or there will be a plan soon. And I guess everybody's a little bit nervous because May 1st is coming Friday. So I just didn't know if anybody could speak to a plan for that.
I can speak a little bit to watching the numbers both in Utah and in Colorado. We meet weekly with the healthcare systems, both on the Western Slope and on the Wasatch Front, in terms of looking at what their capacity is for transfer. And we've all talked about finding that metric that sort of triggers the alarm bell to go off. And we'd like to see that alarm bell go off well before it's an actual emergency and surge. We're working, at least from the hospital side of things, of identifying what that would be. But essentially all of us are watching trends on positive tests and hospitalizations to make sure that it's staying flat or growing slowly.
One additional measure that we'll be keeping track is the transmission rate. You know, early on in this process, we were looking at a transmission rate of around just under 3. Now it's hovering at about 1. So that means just about 1 person is infected for every case. And it would be great to put a defined number to each of those, whether it's hospital utilization or percent positivity. However, they are pretty all intertwined. So they will be looked at as a whole, really, to determine what is the alarm potential for alarm in Grand County.
And do any of us know, have we retained the local power? Can we ring our own alarm?
Yeah, we can ring our own alarm. I will say with the caveat that if we feel like there's an alarm, we do need to notify the governor's office that we feel that way, and initiate at least some sort of discussion there.
Okay, and I just want to thank you guys for the information you put out, and it sounds like people are pretty well equipped with medical equipment and PPE at this point. In some national stories, and this probably won't become an issue for us, but there was some discussion about shortage of dialysis. And do we know, does our region, if for some reason we exploded, do we have that amply? You know, if a lot of people ended up needing dialysis.
Right. So, you know, I mean, I suppose, again, you'd have to look both at the rates, not just within Grand County, but in the whole region, you know, Western Colorado, Northern Utah. You know, all of the concentration of, for the most part, dialysis units are, you know, in those higher population centers up in Northern Utah. Right now, I have not seen any specific, you know, data or tracking metrics on a daily basis or a weekly basis looking at dialysis units in the same way that, you know, we look at ICU bed capacity, for example. But, you know, those things are gonna, just based on the, I would say, based on the, you know, common percentages or trends in which those services are needed, you would probably start seeing, you know, which one of those became the most rate limiting might vary a little bit, but you'd probably start seeing a burden on all of those services, you know, similarly around, you know, and in similar fashion. So I think we'd have some warning as to that right now. And again, it's very difficult because we've had conversations and we've looked at modeling of how does this look over time, right? But the challenge is the models are all highly prone to error. They're only as good as the inputs you put in, and they're certainly going to change to some extent based on the changing social distancing strategies that we take. But as of right now, both Utah and Colorado are not expecting to, you know, exceed capacity for those sorts of, you know, critical care service things. And I would say at this point, dialysis I would include in that list, but we'd have to look more specifically at it to know, you know, could that potentially be a limiting factor prior to other things that have been discussed, you know, like ventilators or ICU care.
Okay, and I just wanted to take this chance to thank those of you from the hospital working with the EMS Special Service District, because I know you were trying to help them get 2 ventilators, and I understand that the feds intercepted those 2. And so EMS still doesn't have 2, and you know, they're coming up with alternate ways to deal, but I just wanted to make sure that the community was clear that some of the equipment that some of our crews would ideally have, we still don't, just because I thought it was important. This is probably more an issue for the larger group, but I guess I was wondering if those of you on the health end have any advice for us, because another concern I'm getting from a lot of people is how in the world are we going to enforce this? Like, it's great to limit the number of lodging and the campgrounds, but we already have law enforcement officers. I know of one with state parks who have been struggling, to send people home from all over across the country, and some international people who, even though, there's been press, there's been education, people know they're not supposed to come, they're coming anyway, so far. And then now, as NPR reported today that Moab's open for business, I think there's a little bit of concern, or the public needs reassurance that we even have the capacity to enforce not only the rules we're setting, but also some of the numbers. So I just didn't know if anyone had more of an update for the public about that. And I know there have been requests for things like, can you guys just do a really aggressive education campaign? I mean, everything from banners across Main Street to electric signs, that says we have rules here, we're asking you to distance, to cover your faces, but I just am wondering, since May 1st is coming, like if we're ready for that part of it.
Certainly, the enforcement part of it is a challenge, and as the first order that was implemented in March 17th, excuse me, it did take a little bit of time, a week or so, to work with booking companies, to work with hotels, to establish practices and policies that helped them to meet the requirements of the order. So I would expect, even though we have given a little bit of notice, there will be some hiccups along the way, but they showed compliance with that more strict order, and I would expect them to be anxious to comply even as we loosen things up. That being said, we will not see 100% in compliance, because that's such a large job. We want people to respect the rules that are being laid down. There will be some options for penalties that we're working out with the county attorney right now. But with everything we've done, the main purpose has been education. The main thrust is not to penalize somebody, though it must be a possibility to have some teeth. But we really would rather not have people violating that and getting in trouble. We'd rather have them respecting the needs and the circumstances of the community. And how that a lot will be, the travel council has taken into consideration where they will or will not advertise. There won't be a lot of advertising going on now, despite the fact that people will realize that Moab is open to some extent. But that aggressive reaching out to other communities won't happen yet. Some of those other elements do seem very nice. Right now, we don't have specific, kind of community-wide electric lights and
Well, I didn't just want to put that on you. I mean, this was partially a conversation. I mean, I know this falls on us with the city with law enforcement, and it falls on us working with the travel council. So some of that, I mean, I could see, yeah, it definitely falls on. I wasn't putting that all on you, but I just thought if you guys had tips for us, yeah.
I think it's worth the continued conversation.
I would also add, at the hospital, we hand out masks to everybody and require their use in our facility. And a business is a private place. And signs like no shirt, no shoes, no service are certainly something that we're familiar with. And I would encourage business owners to protect the employees that work for you. They're your very most valuable asset. And so if you mandate people from out of this community where we have no idea what their exposure is, if you mandate for those people to wear masks in your business, you are protecting your employees and you are protecting your other customers. And so I would also say it's not the health departments or the cities or the counties or the hospital's responsibility. This is really a community effort to mitigate spread and keep the curve flat so that we don't take one step forward and then have to take 2 steps back. It really will take everybody doing the right thing and encouraging people to do the right thing, even if that means saying, sorry, we require masks at City Market, and we've got some t-shirts you can wrap around your face, something that you can use. But it's important that everybody in this town takes it seriously and doesn't feel like this is their moment to flaunt their freedom. This is our moment to pull together and keep moving our economy forward and not have to take it back.
Absolutely. Well put. Everyone, it is 7:45 and I did not, I did not ask for your 45 minutes. I asked for 15 minutes. And so the three of you have been here well beyond the time that I asked for. I'm super grateful. Looks like other council members are grateful. Tani, did you raise your hand? Did you want to say a
I
quick?
did. I had a question, but I can email Braden or Jen. I just wondered if there were plans to work with the management companies or the travel council to monitor some of the reservations and how people were clumping up. But I can get that later. It's just we are at 45 minutes, so I can find out later.
My brief answer is just that we didn't create our lodging proposal just at the health department. We involved a lot of people, so they're aware of it and starting to think about those plans. We don't have a concrete plan in place yet, but expect to have something.
Okay.
Karen, you had something?
That's really quick. I was just curious, Jen and Dr. Cole, how long are the tests taking to get the results?
Yeah, so generally speaking, so we're sending both to the state lab as well as also to some reference labs for in some test cases. And typically turnaround times are coming back in around 3 days, but there have been occasions in which they're taking 4 or 5 days still. So usually 2 to 3, but sometimes as long as 4 to 5.
Okay, and then do you, like off the cuff, do you know how many tests we've done in town so far?
Ballpark, Brady, you probably know the number more recent than me. I think ballpark 300-400 or so.
About it's just over 400.
Mm-hmm.
Okay.
All right. Thank you so much, Jen and Brady and Dr. Cole. I'm so grateful that you joined us. We're going to get back to work here on our meeting. Thank you so much.
Thank you so much.
Thank you.
Thank you.
Ronnie, did you have something you needed to
Oh,
share?
not for them, but I did have a few questions. I didn't know how much other COVID stuff you guys that had questions that were specific for staff. Like Joel, I got a question.
I'm gonna interrupt you because we do have it as an agenda item.
Oh, okay. I just figured this was part of that. Okay, we're gonna come back to it.
Well, or if it's okay with everyone, we can just finish up with all things COVID now. Why don't we go ahead and finish up with our COVID questions and updates now? Joel, Carly, is that okay with you both? Okay.
I don't know if you guys had some presentation you want to do first, or if you just want random questions.
So no, I think that we had prepared some stuff. It was outlining what they had been released. I wasn't aware earlier that the mayor had invited the hospital and the health department to come in, and they did an exceptional job and did far better than I ever could have. So I can't thank them enough. Thank the mayor for doing that. So, but the materials we prepared was outlining all of the new orders, and they've already done that. So I think we should jump right to questions, and I'll comment on anything that doesn't get covered at the end.
Okay, one of the first ones someone asked me today was when the city offices are going to open.
That's a great question.
That's why I'm giving it to you.
Yeah, I think we've had that discussion several times here at City Hall. I think about the time we open City Hall will be about the time we start having in-face meetings again. I think that it's probably a pretty good standard of, there's times when City Hall's open and we have 3 or 4 people in the police department, we have 3 or 4 people in planning, and we have 2 or 3 people paying their they're paying their water bill. We have 2 people in the admin suite. So there's times, and then we have tenants who also are using the building. AP&P will have 3 or 4 people down there. And so there's times there's 20, 25 people who are not employees in the building taking care of business. And so, you know, until those restrictions get lifted, that we can have people in closed space that are in a safe way, then we're probably we're not yet, I guess is the answer. We want to open it. We're trying to get to that point. We've discussed with our staff how we can reopen the MARC, the MRAC, the gym, City Hall. We have our staff preparing mitigation plans on the MRAC and the MARC and the gym. We think that the MRAC is going to be here. We're going to try and shoot for Monday, but I don't know if that will happen with kind of what we've been doing over there over the last month. Terry and her staff, who the remainder of her staff, which are very, very few, have basically re-cleaned and painted and washed and scrubbed every inch of that building to dusting off the ceiling installation and everything. I mean, just so we're finally wrapping that up. We've got that whole facility touched up, and we're getting ready to reopen that to a very, very limited use. So, but we're trying to get these institutions reopened. The pool, outdoor pool, creates a whole nother logistical nightmare. It's constructed in a way that it has to have the water put back in it in order to keep it shaped, get the pressure back out. So we have to fill the pool. It's cheaper to fill it and run it on a very minimal process rather than shut it down. If we can't open it for a year, then to shut it down and go in and try and get it reoperating. So the outdoor pool is full, it's clean, it's functioning on a very bare minimum level. We're not heating it, obviously. So, but if we get the ability to open, because we need to operate it to keep it going, we're ready to open when we get to that point.
Just from the city side, do you guys on the task force have any advice for us on responding to people who are asking questions about enforcement and education? Like, do we have any way to put some of our electronic signs up and, I mean, make sure we're at I-70, we're south of town, we're on the east side of town, to let people know that we are practicing social distancing and we are asking people to do some things. I mean, I'm sure the coffee center would love some business or someone else to make a banner to go across Main Street in a few places. But I think people are just wondering, feeling like we're going to be hit hard and we have to do everything we can to educate our visitors that it isn't necessarily just free for all virus vacation time.
Well, yeah. There's 3 or 4 things that you put in there. So let me kind of work through them. One, as far as enforcement goes, and as far as us doing a good job as a city, as a county, and as a health department enforcing it, we need your help. You know, if there's a hotel that you're working for and you're a part of the grounds crew or something, and you know that they're breaking the rules and they're over renting the number of rooms they're allowed to, we need you to call that in. They're risking you as an employee, they're risking you and this community in order for that purpose. And we need to be told that the easiest way for us to know if there's violations going on is for someone to call it in. And so we need the community to come together, and we need the community, if they see something, to let us know. And
that, to be really clear, if somebody were to see a violation of the health department order or what's going to come out as the governor's order,
they can call either dispatch and report it straight to the police department, or they can call 259-5121 and report it straight to City Hall, and we'll follow up on it. We'll follow up on everything that gets reported.
And dispatch is 259-8115, right?
Yep. And so, you know, we need your help as a community. We need the community to come together under the idea of the social compact. And if everyone's in the store and someone walks in within the store, I don't want people to be confrontational. I don't want them to cause an issue, but turn to someone and say, "Where's your mask?" You know, ask them if it's the order and they're to be wearing one. Say, "Hey, you need to have your mask on." You know, and so they're obviously not going to comply with that, but just those small things that put the social pressure on people to do what's good for the community rather than what's convenient for themselves in the moment. And that's important. So those are the small things. The signage, a sign all the way out to I-70 would be complex just because none of those roads are ours. Obviously, you're getting out to the interstate, and that's a whole nother issue, and the highway is a whole nother issue. But you know, that's a double-edged sword, because everyone who comes down here knows these rules are out there. There's no one who doesn't know that social distancing is an issue right now. There's no one who doesn't know. We can put it up, and the people who are going to comply are going to comply, and the people who aren't, then we're going to have to deal with it. But we can do signage, absolutely. I don't know if you guys caught the articles on the news and in the paper about Sand Hollow and all the state parks down in St. George that by midway through Saturday were shut down because they're 100% at capacity. I've already been getting sent tonight. I'm getting blown up by texts and emails of things on Facebook that are, you know, this date, all the OHVs are coming to town to support local business and we need to rally down there to help. They all know what's going on. They all know they need to be wearing masks. They all know they should be staying home. They all know that they should be social distancing. We're more than happy to put up signs. But I don't know what good it's going to do with that group. I'm not saying the OHV group, I mean the group that's going to ignore it.
Yeah,
So
Just a quick question for workers. I know the health department information definitely has protections written in there for people who aren't coming to work because they're sick. Does anyone know, are there any protections, whistleblower protections? I mean, you know, some people are going to be afraid to call into the city or dispatch and mention an employer if they aren't following the rules. Is there, under a situation like this, are there any added protections, or are there any base protections for people like that?
anytime you report an employer for violations of the law, those safety provisions kick in. So this would fall under that category.
Maybe when we do our education, we can just mention that, yeah.
And there's no reason for these people who call and make the report to give their name. And they can make an anonymous report. We can follow up on anonymous reports. We do all the time. What other questions do we have?
Today, the governor mentioned switching from groups of 6 or, well, 10, I guess, to 20. Are we expecting local changes on anything?
So a lot of the orders that the health department just put into place, they're on square footage requirements.
Yeah.
So they're changing them up already a little bit. Gyms are 1 person per 100 square feet. I think restaurants 1 per 120. I can't remember the exact number for restaurants, but they had one in there as well. So, but they have those requirements in place. So I at this point, from my understanding with the health department, we're just following those guidelines that are out there. And if that's the governor's order, then the 20 will be the number that we're going to follow going forward.
So because we are at almost 8 o'clock, unless there are any other burning questions specific to city operations, we should probably move on with the rest of our agenda.
We did have a meeting with staff. We've updated staff on all these rule changes. They're aware. We also ordered through a local vendor today a masks for employees. All city employees will be required to wear a mask and be in compliance with these same regulations. And so we're aware of them and we'll enforce them and we'll also live by them. Yeah. Okay.
Well, thank you so much, Joel. Thanks for updates. And again, thanks to the hospital staff and Brady for joining us to give us a very extensive COVID-19 update, which is really helpful because we are changing how we've been operating over the past several weeks. And I just encourage us all to follow tomorrow what the governor puts out, because that's really going to be the final answer of what it's going to look like on Friday. So going back to our agenda, let's see, we are at approval of minutes. We've got minutes from February 25th, March 10th, March 24th, April 1st, April 10th, and April 16th. How exhaustive is that?
Mayor, can I just say, Ronnie actually pointed out that we approved the March 10th meeting minutes at the April 14th. And so disregard that set.
That's right. But February 25th still
yes.
needs approval.
Yes, so, all of the rest of those, just not the March
10th. And I'm assuming that any comments for minutes have been submitted. But I would entertain a motion to approve one or all of those minutes.
I move to approve the minutes from February 25th, March 24th, April 1st, April 10th, and April 16th.
Thank you, Karen. Is there a second?
I will second.
Thank you, Mike. Discussion?
They're long.
I will roll call this vote. Kaylin.
Aye.
Karen.
Aye.
Tawny,
Aye.
Mike,
Aye.
Ronnie.
Aye.
Thank you. Motion passes 5-0. We're now at mayor and council reports. I will go first and I will be brief. Let's see. Carly, Joel, and I have been meeting every Thursday. I wanted this council to be aware that I am in regular meetings with Carly and Joel. And it's been very nice to have that that weekly set meeting. So thank you, Joel and Carly, for being available for that. I was asked to share a notice of grant award to our airport, the Canyonlands Field Airport. I didn't know, Karen, if you were going to share that or not, having been on the board, but I was asked by Senator Romney's office and Congressman John Curtis's office as well. They received $1,057,748. So we're very lucky. That was quite a big award. Let's see. I wanted to thank Marcy and Joel for putting together the email and calling all of our emails for our businesses that are licensed in the state, in the city. There is an Office of Outdoor Recreation survey. That office is under GOED, Governor's Office of Economic Development. And right now, what GOED is trying to do is understand just how uniquely impacted we are as a recreation community. Yeah. So it is very, very, very important for businesses in our community to complete this survey, because this will be the data that the governor's office will use for potential allocation for additional stimulus funds for our community. So I shared that link with Lacey with the chamber, and also with Wes with the newly formed Moab Downtown Business Alliance. And if you run a business and have a license, you've received it. So I just would like for all of us to encourage people to fill out that survey, because again, it really could bring resources to us, state resources to us in particular. And as I told you before, I serve on GOED State and Local Resources Subcommittee. I wanted to report that GOED has actually dispersed $12 million in our state of stimulus loan money, similar to what was administered through the CARES Act. And of that 12 million, 30% was spent in rural Utah. And that was very reassuring, because we are often forgotten, and the Wasatch Front gobbles up a lot of money that would otherwise be really helpful for us down here in rural Utah. So 30% was a huge percentage. And I'm very grateful to GOED for that funding. And I know personally some businesses that received those funds. So there's that. I also attended a water quality board meeting. They did a workshop on stormwater management, and from a developer's perspective, it saves a lot of money to have new stormwater management practices and policies in place. So coming from the state, that's a very good thing for us in particular in our community, because we're in such a flood zone. And stormwater management is so critical for projects that are built. So being able to retain water on site and creative ways to do that is helpful. And I attended a Governor's Rural Partnership Board meeting today as well. And we are just gearing up to present to the governor in the summer at our summer meeting, ideas of how to really allocate resources. And so I do sit on that board as an appointment from the League of Cities and Towns. And so it's from a rural city perspective. And of course, I talked a lot about housing, transportation, and rural broadband, because wouldn't this be the year to focus on that as an incentive? I've done other things, but that's pretty much what's worth reporting from me. And I guess we'll go now to Ronnie.
Okay, I'll be real brief. We had 2 meetings, April 16th and 20th for the council that I attended, having to do with our hotspot committee and stakeholder group. And I was just going to ask as a follow-up, we did get that question from the resident about how we posted that and how people, in the future could become members of these stakeholder groups and committees. So I was just going to ask if we could have some kind of follow-up where we could set up some kind of system so people in the future know, like, oh, okay, if there are openings or opportunities, we'll list them or post them here, so that everybody feels like they have a shot if they're interested. I don't know.
We can absolutely do that, and we can get something created. In this particular example, we had our council meeting on Tuesday and appointed someone on Friday. We couldn't have gotten something in the paper even if we'd have wanted to. I mean, the window was so tight on this one but in the future, we absolutely should, and where we have larger timeframes, we absolutely need to do a better job of getting it out. I just want to make it clear, though, that even if on Tuesday night, council said to us, we need to put this in the paper, our response would have had to have been, well, then we need to put this out 2 weeks in order, or at least a week in order for us to be able to even meet the timeframes to do that. So this one was just too tight. Yeah,
thanks for that. And then I just got an update from EMS, probably not surprisingly for you guys. They've had their first 2 months with lower numbers than in previous years, but I think we all know why that is. And I mentioned that we're trying to get 2 ventilators. So if anyone has any pull with the feds or can find out where they hit those 2, let us know. And I think that was it for me.
Thank you, Ronnie. Mike.
Very quickly, your Arches Hotspot Committee met last week, going to meet again tomorrow. And the most interesting part was the list of projects that various members preferred. There was kind of a wide disparity there, but I'm looking forward to trying to narrow the list down tomorrow. That'll be interesting. Emily, USU meetings, what you delegated that to me. I have not seen any notices of meetings, so you might, I don't know what's going on there.
May just not be meeting right now.
Yeah, it could be. A couple things about residents. I know 2 residents personally now, as well as myself, who've expressed an interest, some way to be able to burn trash, not trash, but brush and weeds and that sort of thing, which we used to be able to do until about a year ago when we decided to enforce a no burn ordinance in town. And I would like to resurrect a consideration of that issue under some circumstances that would be acceptable to the city. So anyway, that's coming up, just a heads up. For something I would wish to address to you guys and staff coming down the road.
So Mike, we can absolutely get that on the agenda. That ordinance that prohibits burning was passed by the city in 2004. And we put that on the agenda twice in the last year to reconsider it. And both times we chose to not act on it. So are you asking us to do it for a 3rd time?
Yeah, let me talk about it to you guys offline. Okay, that'd be great. Thank you. And finally, a couple of residents who are talking to it. I'm going to party their business owners and so forth, but and who expressed unhappiness with city staff about not returning calls in certain departments. And I'm not going to get into it obviously here, but so forth. But Joel and Carly, I'll talk to you guys again about just to once again. And I know, boy, do I know how busy you guys are and how many things, issues, and fires you're trying to put out. But still, getting back to residents promptly is one of our most critical things that we can do. So I'll talk to you guys offline about relatively little problems, but just another hammer, like stay responsive to residents. So that's about it. Thank you.
Sorry about that. Thank you, Mike. Next up is Tawny.
I attended a museum board meeting, and they are just plugging along, trying to create a museum online where they were going to be open. And they are doing some really, really creative and really fun things. If you have a chance, look at the website. And even though it's the museum's not open. They've done a really good job of creating a virtual experience until they can be open. And they are looking, I do believe, not before the first week in July to actually be physically open. I think I attended all of my care center board meetings prior to our last meeting, and I have webinared and Zoom phone called, and I know so much about so many things that I might not ever use, but it's been very interesting. That's it.
Sorry about that. Thank you, Tani. Karen?
Okay, so April 17th, watch the governor's address, Utah Leads 2.0, as he introduced the plan to balance economic concerns with public health, which we are finding ourselves in this coming Friday. Attended the, or sat in, Zoomed the ULCT town hall meeting with Ben McAdams. He spoke of the Stimulus CARES Act Part 2. He also mentioned that he was dedicating his staff. This is important for all small businesses out there who are having difficulty with the SBA or any loan funding, because it really, again, it has been very difficult for many of our businesses in Utah. That he is dedicating his staff to directly help small business, and he can be reached at mcadams.house.gov. Natalie Gocknauer, I don't know if I pronounced that correctly, the director of the Kim Gardner Policy Institute, went into the Utah Leads Together 2.0 version, as she was one of the commission members who drafted the plan for the governor. And she kept emphasizing that local communities will be able to adjust their dials and shift between the different color-coded guidelines by using local data in conjunction with public health officials. So hopefully we'll see that Brady will be successful in the plan that he produced, and that the governor is going to accept the fact that we are a special, unique community that has its own guidelines. So I guess we'll see if that acceptance happens. And then she also was mentioning that last week's unemployment rates in Utah were at 100,000, and 70% of those claimants are still tied to jobs. So with the PPP and the unemployment insurance claims, how important that is to get that funding going, so that there's quite a few businesses that are hanging on by a thread and trying to keep people tied to their employees, or it's going to be imperative as we move forward. So then we had our special council meeting, choosing the candidate for the hotspot and RTP. Attended the Economic Task Force Town Hall. And again, it was another PPP update for Utah, from our Utah federal delegation. So Romney and McAdams were on that as well, and they were discussing what was happening in Washington, DC. And the chamber took part of the webinar to discuss how businesses can reactivate the economy in the 2.0 plan. I had a chamber board meeting, and the chamber has been working very hard to get information out to businesses as soon as it becomes available. They've been working closely with the local economic task force, which includes Zachariah Levine's office and the Office of Tourism, our travel council. And as many of you know, their department has been cut. They had 5 staff and they're down to 2. And as we are entering into this, in this moment of trying to open up slowly and to get education out, I mean, I would just maybe plug some support for the travel council to do the education piece. Sorry, Elaine has been working really hard, and you know, having just 2 people in that department right now is going to be a challenge as we are opening up. So, and then let's see here. We had the hotspot coordinating committee, and just Mike, like he mentioned, seems like the group was interested in Main Street improvements, dispersed parking. And out of that group, no one was interested in revisiting the parking structure, which I thought was interesting because it was also on the table. Like Mike said, the next meeting is tomorrow, 1 to 3. And then yesterday, the ULTC's Town Hall Economic Impact Series. Quick facts, 57,000 small business enterprises in Utah with under 20 employees. Under the first round of the CARES Act program, 21,000 businesses were approved for the PPP, which is 2 months of payroll protection. And the 18,000 applied for the second round. As of even today, there's quite a few people who haven't heard word if they have gotten the funding or not. So hopefully we'll find out if people have been approved. I know there's quite a few businesses in our town that are waiting for that funding for that second round of stimulus money. So something for us to consider is that 1 out of every 20 workers is undocumented in the state. That means that they don't qualify for unemployment insurance and they don't have protection with renters' rights, and they primarily work in food service and accommodations. And in Grand County, as of last week, because it's a week behind for unemployment insurance claims, we are the highest in the state at 20%. So that we are, obviously we all can feel the impacts of what is happening, but it is particularly felt in our community. And then I keep neglecting to talk about the census. And the state of Utah, right now we are ranked number 7 in the United States for our response rate. Grand County is 16th out of 29 counties, and the city is 124 out of 247 cities. So I am pleading with everyone to bug their neighbors at a safe distance, of course, to fill out the census. And it's easier than ever. You just go to 2020census.gov and you can do it online. And that's it.
Thank you, Karen. Kaylin, you're up.
So I'll continue with the Travel Council piece. The Travel Council has not advertised anywhere since March 17th. And they also offer a format for filing complaints about non-compliant lodging. You can do that at the Do It Like a Moab local website. And even though they're not advertising out of the area, they are educating the public on Discover Moab and Do It Like a Moab local about what our current scene is in regards to COVID and being open. I also attended 2 Moab Dark Skies meetings. Of interest, the county building and office building inspector is now doing lighting inspections for enforcing their lighting code, which is new for them to take on things outside the International Code Council's regulations. And we've mainly been working on the Friends of the Milky Way, which is like the Green to Go program, sort of business certification, but specifically focused on lighting. And that's a city-county Moab Dark Skies collaborative project. And the Travel Council Sustainability Committee met with the Sedona Chamber president, and they've been really working for years on their tourism sustainability efforts, which has been, at least as they portrayed it, really helps bridge the gap with the same tensions that we're having here in terms of having a lot of tourism growth, but also that really being the backbone of their economy. So finding a way to dialogue about that and move forward. I went to the Hotspot Committee, which has been covered already. And at the solid waste, as I suspect most of you know, the recycling center has been open 2 days a week. And that's been very popular. And what we're discussing continuing with that even as we gradually open up for the time being, although that will be subject to discussion, I'm sure. And as many of you may know, Moab is faced with an unprecedented proposal to lease over 110,000 acres for oil and gas development on BLM lands north, west, and south of town. So I'm just going to screen share quickly. And so this is our home. And Sitla active in oil and gas are these parcels. BLM existing oil and gas leases are these parcels. And then what has been, one company has expressed interest in leasing that. So that is a massive, that would be a massive new expansion of oil and gas leases. They're being pursued by one small Minnesota-based company that is expressed interest, and it's nearly all the remaining available unleased oil and gas parcels in the Moab region. Recent oil and gas lease sales in Utah have resulted in non-competitive auctions, with the majority of the parcels going for the minimum bid of $2 per acre. So with one interested bidder during a time of record low oil and gas demand, the auction could leave these areas tied up in oil and gas leases for decades, discouraging future trail and campground investments and impairing our outdoor recreation economy. So I have been talking with Joel and Emily and others about how we might want to respond. One strategy would be to pursue a cooperating agency agreement with the BLM so that we could at least be in formal dialogue with them during their environmental assessment preparation, which will be released in roughly 3 weeks. It's not as clear cut as with the couple parcels up on Sand Flats, which were so obviously bad, but was a very limited area. With the master leasing plan, the local outdoor recreation community took a more nuanced approach with trying to figure out how to do zoning effectively. And so, but it's really a massive lease. So arguments can be made that we should just oppose it, but that might be annoying to some of our constituents as well as politicians upstate. So this is an ongoing dialogue, but we should respond quickly. So I'd encourage you to talk to me, talk to the mayor, talk to Joel about your concerns. And that's what I've got.
Kaylin, if I just might add to what you were just talking about, there is concern too that the parcels that would be leased now would be leased at just the lowest of the lowest amount of money. And so postponing or deferring until our economy is at a place where more money, more revenue could be made is part of a consideration as well. We should decide as a, oh, were you going to say something? Sorry.
Yeah, I was just going to say, absolutely. It could potentially be a massive giveaway for the American taxpayer as well as for our recreation economy. So it doesn't make a lot of sense, but under the energy dominance policy coming out of DC, that's where the BLM is being steered.
It's complicated because, again, there are a lot of recreation spots of this particular area, lots of trails that intersect parcels that are up for lease. Carly, did you want to share anything? Because I know you've been following this as well.
I mean, I agree with Kaylin that there needs to be a balancing act about the appropriate strategy. I think a cooperating agency approach is a good one to start with. And then if we want to flat out oppose it later, we can. It keeps all our options open.
Yeah. Okay. Thank you, Kaylin, for your reports. I forgot to report on one thing. I apologize. There is a housing relief fund that is getting started in Moab. Lots of people are giving to it. So to piggyback what Karen, you were saying about the most vulnerable of our population and service workers not having access to these federal and state funding opportunities or through employer, this housing relief fund is a great opportunity for those who receive a stimulus check and maybe don't need it, that they could donate their stimulus check to this organization. I wanted to share that on that committee, the Housing Relief Fund Special Committee, there is a representative from Grand County, Mila Dunbar Irwin. She works with Zachariah in his office. There's Ben Riley and Jenna from the Housing Authority of Southeastern Utah, Rihanna from the Multicultural Center, and Caitlin from the City of Moab, our housing specialist, all serve on the special committee that will oversee the donations received and the way in which they'll be dispersed. The website for that fund is moabcovid.org. So please share with those that you think might be interested in donating. That will likely be the one fund that is kind of a more front-facing fund that will help those very vulnerable of our population. Okay, so moving on to administrative reports, Joel.
Yeah, so I have a lot, but I'm going to be brief. I'm going to cut it down. The Lions Back development, which is up on Sand Flats Road, is going forward. They have provided us with new drawings that we received today. I've had several of you asking me about this lately, but we received new drawings from them today. They have to be finalized, and they have to have some finalized documents that go along with those before a permit would be issued, but that project is still skirting along. So just a heads up that that's out there and going. We can talk about that more if you have questions. We got the Go Ahead survey out there. We sent it to 528 emails of what we had. In case any of you have ever tried that, there's a limit to Gmail. You can only send to 500 recipients at once. So don't try and go for more than that. It causes all sorts of chaos. The Highway 191 project is moving forward. They've established curb and gutter on the east side, which will allow them to move traffic further east and get to moving the utilities on the project. This week, we'll see major advancements in the project as they still are working Monday through Friday without night crews. They've been flexing their schedule a little to accommodate the reduction in traffic, which this year has been 25 to 30% of traffic compared to last year at this time. Thought those traffic studies were pretty interesting. They've also detoured bicycle and foot traffic down 500 west to 4th north, then up to 100 west to 200 north, back up to Main. And they are currently on schedule, and they're currently on schedule to do it in a year or under and not go into next spring. So that is all going really, really well. RAP tax resolution was passed by the county last Tuesday, and we will go forward with that. They gave us the authorization to do it as a city. So we are meeting Thursday as a staff to go over the timeline and the outline for all of that, a resolution. So basically at the next meeting, May 12th, I will do a RAP tax presentation to you guys and give you the timelines and lay everything out. Then on the follow-up meeting, which I think is the 26th, you'll see a resolution that's authorizing it to go forward. So that's the timeline for the RAP tax and what we're doing there. We basically have to have everything kind of wrapped up by September, October. We're well on pace to do that. So we're meeting all those deadlines. We do need to have another meeting on May 9th, Friday, to extend the emergency order. Just giving you a heads up, should be a 5-minute meeting, long enough to just vote on it, move it forward for 30 more days if we need to do that. That determination we can make next week sometime. So, but just giving everyone a heads up, next Friday, a week from this Friday, we may need to have a meeting that will literally last 2 minutes, 3 minutes if we have to have it. So, and then lastly, Mayor, last meeting, you guys asked me to do a legislative update from the special session. I've outlined all those bills and was prepared to do that. I don't know how much of that you really want to get into at this point. the main highlight, I can just give you the rundown real quick. They passed a joint resolution 301, which really urges cities to be financially and fiscally responsible during this time and to make sure that they're cutting their spending, doing hiring freezes and doing spending freezes. We've already done all of those. We're already doing those things that we're asked. There's the Pandemic and Emergency Relief Act, which allows the governor to take action, which you've seen. They've done 3006, which was election amendments that will allow them to change up how the election in the fall is held. It doesn't affect us all that much because we were already vote by mail, but it could affect how early voting could happen, and it could affect how you drop off your ballot at a location. So, and it does change the deadline for when your ballot has to be marked, allowing it to be the day of the election. So that was pretty interesting to see how they're kind of changing that up. But like I said, because we were already all mail, it didn't have that big of an effect. House Bill 3007 created for first responders a presumption that if they get COVID-19, that it is a workman's comp claim under our policy, which it should be. You know, it was a good bill. I'm glad they passed it. But that they did do that, and that would apply to EMS and others. But for us as the city, that's applying to our officers, and there's a presumption that if they get COVID, it's due to exposure from work, and then they have a claim under that rule. So that's about it. 3004, everyone's talked about to death, and then unemployment benefits amendment, waiving the 1 week and all that, everyone's aware of. So that's the rundown on the quick legislation that happened. If you have questions, I've outlined all of it. I have it all. I have copies of all of it highlighted out. If you want copies of it, I'm happy to provide it to you. So that's it on the quick run. So.
Okay, then thank you for those updates, and we will be moving right along. We're at section 7, citizens to be heard. We have received 6 comments to date, or by 7 p.m. tonight for our meeting. And reminder that those are available on our city website for all to read and see. They are made available if you go to our agenda center, or if you search agendas. I believe it's to the right. It's in a bar on the right-hand side of that web page. When I went to look at it first, I got confused. I couldn't find it because I wasn't looking on the right-hand bar. So if anybody has any questions about reviewing those comments, then just call 259-5121 and somebody will answer and walk you through it. Next item on our agenda. We already reviewed section 8, old business 8.1, our COVID-19 updates. So we are actually on to section 9 of our agenda, new business, 9.1, proposed resolution 25, 2020, a resolution amending the City of Moab employee handbook. Joel, do you have any comments that you'd like to make on the handbook? Or discussion items you'd like to have before I would entertain a motion?
Mayor, we did just, and this is entirely up to you as the chair. I'm not in any way, just so you have no, Danny did prepare a short presentation. If we don't want to do it, I'm sure she would not be heartbroken whatsoever if we skip.
There's Danny. Danny, please share your presentation.
Okay, I can do that.
You're welcome, Danny.
Thanks, Joel. I appreciate it. It is super short, so it shouldn't take up too much time, and then I'll answer whatever questions you guys have. Okay, let me minimize you guys out so I can see my screen. All right, so I just put together a little quick presentation on the 17 topics that we updated in the personnel manual. So the first change to the handbook is the per diem policy and the way that the per diem is paid out. Per diem will now be calculated by how many hours you are gone each day instead of when you leave and return. So right now, if you're traveling less than 8 hours, you'll get $13, 8 to 12 hours, $30. You're traveling more than 12 hours, that's $50. One question I did have from council was if this included out-of-state travel, and it does. The next change that we had is to the compensatory time policy. This policy establishes an annual limit of 100 hours, which means employees can accrue up to 100 hours per fiscal year of comp time. At the point they reach that 100 hours, they will then switch over to overtime for the remainder of the fiscal year. Our next policy that changes the compensation management plan. This reduces the max pay increase from 5 to 3%. So here's the schedule that you should have all seen in the manual. And this isn't a new schedule, it just lowers the amounts there at the very last column. Moving on, we have the acting positions policy. This adds a 16-day rule. This rule is if a supervisor is off for more than 16 days for leave other than vacation or comp time, the worker who is filling in for that supervisor will receive a pay increase not less than 3%. The next policy that we did an update on is the longevity policy. This policy clarifies kind of how the longevity policy is going to work moving forwards. Longevity will only be available if approved during the budget process and is not guaranteed pay. This is a change from what our current manual states. The next policy is our clothing allowance policies. These are not necessarily new policies. We're incorporating the current Public Works and Police uniform policy in this one. Public Works are required to receive a specific amount at hire and replacement items each year or every other year as needed. The clothing allowance for the police department. Newly sworn officers receive this graph right here of all of these different items that they must have for their job. We also will provide replacement ballistic vests on or near the expiration of existing vests. Police officers also receive a uniform allowance each year of $960 for their upkeep of their uniform and equipment. Holidays, we have some change to our holiday policy. The big change is that it clarifies that the holiday schedule must be reviewed each year during the budget process and is subject to approval by City Council. Next, we have our vacation leave. This one was kind of completely redone. This changes how vacation is accrued. It removes annual cash outs and limits the amount of compensable hours for favorable termination. Current employees receive a bucket of vacation hours on their anniversary date. This changes to the per pay period accruals that you can see there in that chart. This policy also allows to roll over up to 240 hours and limits the amount that is compensable upon for favorable termination to 100 hours. So that's quite a big change from what we had prior. Sick leave policy, the change to it is pretty big, but pretty simple. The sick leave policy says that sick leave is no longer compensable. Moving on to bereavement leave policy. This is a new policy that we're establishing. Currently, employees have to use vacation or sick leave if they have a death in their family. This policy will give employees 3 days leave for bereavement and an availability of an additional 2 days if needed. The cell phone policy, again, this isn't a new policy. This is the current policy that we're working under right now. This policy defines who is eligible or required to have a cell phone, the rate the city would pay for the cell phone service, and the option to use Google Voice on their personal cell phones. We've updated our drug-free workplace policy, except for we're doing gun use first, so I apologize for that. Our gun use policy, we're also establishing that policy. It clarifies that police officers are authorized, the only people that are authorized to use deadly force while acting on or for the city. We had a couple of questions about whether employees can open carry. It says there you need to follow the law. So yes, and there are rules, but that's something that's governed by the state, not by us. Here is the drug-free workplace. This policy now includes safety-sensitive positions and criteria for random drug testing. Safety sensitive positions will be subject to the same random testing as CDL holders, and 25% of safety sensitive positions will be random tested each year. We've established a workplace searches policy. This policy clarifies that there is no expectation of privacy regarding city-owned property. We have updated our grievance procedures in our policy. The big change to this is restructuring the employee appeal board to a hearing officer. The hearing officer will be appointed by the mayor and approved by the city council. And the last big change is we have our fleet policy. This policy limits personal use, restricts tobacco use, and includes taxable fringe benefits. This defines which public works employees are required to take city vehicles home and when and what vehicles can be used for. This allows police officers to use their vehicle off duty as long as they're within Grand County boundaries. It also lets us know that no one can be in the city vehicles unless they are a city employer working directly for the city, so no family members. It again restricts the tobacco use in city vehicles, including cigarettes, smokeless tobacco, or e-cigarettes. And it also implements that any authorized personal use of cigarettes will be reported as taxable fringe benefits. So that's my super quick presentation on that.
Danny, that is a lot of work that you put into that. Thank you so much. And Joel as well. In fact, Joel, I just want to say thank you to you for when you held a meeting with staff and shared that these changes were going to be made, that staff understood. They didn't like them, and I'm sure nobody liked amending the policies, but they were receptive and understanding. So, thank you to you all for the work that you put into it and the sensitivity that you put into it as well. I would entertain a motion. Karen?
I move to adopt the resolution 25-2020 approving the amended employee handbook.
Thank you, Karen. Is there a second?
I'll second.
Connie, discussion? Kaylin first, then Ronnie.
So I'm wondering what the thinking is behind the appeal officer being appointed by the mayor. Seems like if there's a employment appeal, it's likely to be be a technical, complicated issue, and it seems like we would want to just hire, I would imagine, an attorney with background in employment law.
That's essentially what would happen, Kaylin, with the position. The person would just be hired at the discretion of the mayor.
But why at the discretion? No offense, Mayor, but why not just have the city manager do the usual?
Well, it
because
would be a
doing-
consent of the council as well. So it's not just a mayoral appointment, but it's with consent of the council. So are you asking why politicize this?
Yes.
As an employee, I would respond, or I would be held to court to that person as well. And so it creates a dynamic where if I'm hiring them and I'm the one who gets in trouble, then I have to go before them and now they answer to me. So by having the mayor do it and you guys approve it, it takes it out of that dynamic. And so they're free to rule on any employment issues that we have.
Mm-hmm. Thank you.
Ronnie, you had a question?
Oh, I was going to thank staff for working on this because I know it's been coming for a while. And as one of the old folks who read the last version years ago, thank you. Very readable, almost enjoyable. No offense, not that it wasn't enjoyable, but as enjoyable as these things can be. Just needed cartoons. Thank you.
If there are no other comments, I will roll call this vote. Karen?
Aye.
Ronnie? Sorry, Ronnie,
Oh, thanks. Aye.
Kaylin,
Aye.
Mike,
Aye.
Tawny.
Aye.
Motion passes 5-0. 9.2, proposed resolution 28, 2020, adopting the tentative fiscal year 2020, 2021 budget. Joel, did we have a presentation for this?
So we gave the presentation 2 weeks ago when we presented the tentative budget, and so we've gone through it all. We didn't have any new questions or requests for changes over the last 2 weeks, so we've submitted to the body. If they want us to do the presentation again, we can do that, or if we have questions, we're happy to answer them.
I would entertain a motion. Ronnie,
I'll move to approve resolution 28-2020, a resolution by the Moab City Council to adopt the City of Moab tentative budget for fiscal year 2020-2021 and set a public hearing for review of the final budget May 12th at 7:00 p.m.
thank you, Ronnie.
Sorry, 7:15. I read that wrong.
Thank you, Ronnie. Is there a second?
I will second.
Thank you, Mike. Discussion? Seeing none, I will call for the roll call vote. Ronnie,
Aye.
Tawny,
Aye.
Karen,
Aye.
Kaylin,
Aye.
Mike.
Aye.
Motion passes 5-0. 9.3, proposed resolution 26-2020, a resolution approving the golf course lease agreement. Joel.
So I was approached by Rob out to the golf course, and Ross, who's a member of the not-for-profit board, a few weeks ago, and was informed by them that they were needing an extension or needing a new lease agreement because of COVID-19 and the financial hit that it's had at the golf course. They were looking to acquire some new loans and do some things out to the golf course. Well, obviously, anytime they went forward with trying to get a loan, they were being asked for a current lease agreement, which the current lease agreement expired with the city back in 2015. So the history of this is the city and the golf course entered into an agreement back in 1959 that allowed them to use the property where the golf course currently is located, and the not-for-profit would operate the golf course. Essentially, the same lease agreement has been used over time since 1959. The last lease agreement was entered into April 12, 2005 between the city and the golf course. And then in December of 2005, that agreement was amended to remove paragraphs 10 and 11 that had said that the golf course needed to pay a small portion of their revenues to the city. So I, having no history, having been here at the time, I went back and I pulled the minutes from the April 2005 meeting and the December 2005 meeting, which had the amendment, and the minutes were no help. They basically said, had the agenda item with a motion and a vote 5-0. There was no amendment or no minutes to it whatsoever. So hoping that maybe that was just how we did minutes at the time, I went back and I pulled the actual audio from both of those meetings to see why those provisions of why they were paying us were removed. And at the time when they removed them, when they got to that in the recording, they literally called the agenda item and they voted on it and it went 5-0. There was no discussion in any of the recordings whatsoever either. So my only two forms of really doing research were the minutes and the recordings, and there was nothing there. So we prepared the lease basically to match what historically had been done for the last 60 years and presented it to the council with basically little to no information as to what the history of it was.
Thank you, Joel. I would entertain a motion, but I also know that this council may have a series of questions. So I look to you all to proceed.
Well, I was concerned why we would remove clauses that indicated that they didn't need to pay us anything of what they were, if they were making money. And I was told that they were not making money at the time. I'm not a golfer. I don't understand how these things work. But I've been educated that that's sort of a problem with municipal golf courses. I'm also a little bit concerned about entering into a 10-year agreement with that that encumbers us somehow, whether we become responsible for the property, or they begin to make money and we're not reaping any of that benefit. So I did have some questions. I spoke briefly with Joel and Carly, and is it appropriate for me to have you explain what you explained to me? You're sitting there laughing with your hand over your mouth.
Joel?
I'm sorry, I missed the question. I was breaking up right when it was, that's why I was laughing, because my audio was going in and out. I could get it.
Can you explain to the rest of the council what you explained to me this afternoon?
About the operations of it?
Yes.
Yes, so historically, golf courses, unless they're private investments, don't tend to make any money. The golf courses that are owned by Salt Lake City all tend to operate in the red. They have an enterprise fund that operates them, kind of like our water and sewer departments do, but they cannot charge fees high enough to ever actually self-regulate. So they end up being subsidized by the general fund of Salt Lake City. So most of the time, in a public held golf course in this situation is not going to turn a revenue, a profit. My guess is, and that's all that this is, my guess is that that is why in 2005 they removed the provision that they were having to pay. I don't know that. Like I said, I tried to do research to figure that out and I couldn't find that information anywhere. But that's, I mean, I think that's a pretty safe presumption, especially with the no discussion aspects of the meetings. I mean, like, it was just cut and dry that they were removing it, it seemed like. So we knew this had, for some reason, without being able to really get a lot of documentation, had been a polarizing issue in the past. So we literally just drafted what had last been approved and resubmitted it with that, rather than try and change anything. Or, you know, with the COVID issues, we talked to Tawny today, and we talked about the 10-year term being long. We suggested that we do it, the term being what the term is, but add a clause that says that the city or the golf course has the right to terminate the lease agreement at any point with, you know, a 6-month or 1-year notice. So everyone has time to know it's coming and get out of it and go forward if that was the case going forward. But currently, with the situation with COVID and everything else that's going on, if the lease wasn't approved and they weren't allowed to get it, and the golf course for some reason financially folded, and I don't know that that's where they're at, that's just the impression that I've been told, I haven't seen their books or anything, then we would be in a situation where that would be, the property would come back to the city. They would have the right to remove any of the improvements that they've put on the property over the last 60 years. So they could go take the buildings off, and they could go take whatever development they have. And then we would have a duty to secure it to some level, or try and operate it. We have no way of financially operating the golf course right now. That's just ludicrous. We can, you know, the situation we're in. So we would be in a situation where we inherited the golf course, and we would have to secure the facility and make sure people were staying off of it. And it would become, it would create 100 other problems outside of everything else we're trying to deal with right now. So I mean, my suggestion would be to continue the lease, have a termination clause where we have the right to get out of it if we have a different plan for it, and then allow it to continue as is, at least for the next few years, in order for us to figure out what, if anything, we want to do with it.
Ronnie, sorry.
So a few of us put a lot of questions about this item on the shared document, but no one responded yet. So I don't know how you guys want to deal with all of those questions, but some of them have to do with the history. And those of us who've been on since 2016 have noted that I mean, we can recall it coming up several times. And I did send you guys all an email that I went back and talked to Kyle Bailey about what he remembered.
Ronnie, I think it would be appropriate for you to just ask those questions now.
Did you say appropriate?
Yes.
Yes.
Okay. Kaylin, I'll let you handle yours. Let's see. Okay, so I went back and tried to talk to some folks because I couldn't remember all the things that had come up. I know, Joel, you said you tried to look at the history, and I have a feeling some of these came up in administrative reports, and they are probably kind of minor mentions of like, oh, we should revisit that when we look at the golf agreement, and then somehow they never got recorded because, you know, someone probably thought someone else would do it. So I've tried to, I sent you guys all that email, so I'm not going to recap on Kyle's points, but one of my questions I asked was, clearly we haven't had an agreement since 2015. So maybe someone can just tell me, how does this work in absence of an agreement? Is it just good faith, or that was my first question.
So after, 59 to 2019, literally 60 years plus of this, you just fall under the standard business practice rule. You have an agreement in the past, you've historically worked under the lease agreements. And if you just keep operating, you're operating, the courts would assume, under the exact same rules that you've had in the past. Now, there's not a really good termination provision in the old agreements, in any of them. And so
there is the bit about the city having the right to terminate having to do, I believe, with our water. I can pull it up, but there was something.
yeah, that's legally not a very good termination provision.
Mm-hmm.
That's a very specific termination provision where you'd have to show causes to why you were terminating. A good termination provision would say either party has the right to terminate this agreement, giving the other party 180 days notice. The reason being whatever.
And then one of them was similar to Tawny's question. Can you offer us advice as to the pros and cons of a 10-year extension versus shorter, and what's the minimum time you would do?
Yeah, I think the benefit to the golf course is that if it's a longer contract time frame, that it helps them secure funding. If it's a one-year lease agreement, that would really inhibit their ability to get funding. If you do a 10-year and you have an agreement that it says that you have a right to terminate with 1 year notice to each other, you essentially legally have a 1-year agreement, but in reality, you have a 10-year agreement on paper, but in reality, you have a 1-year agreement under the rights and the terms. So.
Okay, and then so obviously we all know that paragraphs 10 and 11 came out in 2005, and my understanding from talking to Kyle was his recollection was it probably did come out because they weren't turning a profit and there wasn't a profit. But one of my thoughts was, are we going to have a discussion here about what, if anything, might have changed since 2005 that we need to take under consideration now in thinking about up to a 10-year agreement, and that's everything from the city's financial situation to water, what we know about gray water now, concerns about chemicals, the role of our sustainability plan, and those things.
I think we have Levi here, so he could address any of the water testing or any of the water quality issues that have come up. Levi, is there any? How long have you been doing? How long have you, the water supervisor, been doing your testing out there?
Since I've been here going on 20 years, we've tested quarterly, annually, every 3 years, every 7 years, every 9 years.
And have you seen any changes in the test results?
Absolutely not. No. All the samples come back with minimal results of any radiation, minerals, nitrates.
And Ronnie, I think that leads back to the termination provision. If we have a right to terminate in there that's a year, and we do start seeing changes and we do have issues with what's happening, and we give them notice that we're terminating and we take the property back, or if we're not seeing any changes and the water source is being protected through the use, then it may be the best use for the property. I don't know. I'm definitely not a scientist.
And Levi, may.
Well, hold on, Mike. Ronnie, do you still have other questions? Because we'll just go one at a time. So, Mike, I don't mean to interrupt you, but let's let Ronnie finish hers. Okay? Thanks.
And then I think it's a separate issue, but I just wanted, if people weren't aware from before who hadn't been here, I mean, in years past, we had discussed the need for a new water system for the ground, and it was going to be really expensive, I think multiple millions of dollars. And I just, I was having a brain moment, and I couldn't recall if that has remained on some kind of longer term capital improvements list. There was some discussion years ago about maybe going to the CIB, and I think it wasn't a priority, but I just wanted to let those of you who are newer know that that had been in there at one point.
So the sprinkling system, when I got here in October of 18, was currently on the CIB list, and it's not it hasn't been a ranked high priority on the CIB list in the time frame I've been here. That's where it remains. It's not a priority of the cities. It's not an obligation of the cities under the lease agreement. It's not our obligation or requirement to provide them with any funding or any infrastructure. So we're under no obligation under this lease agreement, nor are we under any obligation to provide them financing to try and get this. The only thing we are doing to help them is providing a renewed lease so they can use that documentation so they can acquire financing to do improvements that they need.
Yeah, just because you had trouble finding history, I thought I would just share that you know, in case this goes in the minutes this time, that my understanding was that had come to us in the first place because it was older and not as efficient. So, and so our agreement says the water rate is mutually agreed upon. And is it going to somehow fall into the water rate study we're doing, or is it a separate, how is it computed or agreed upon?
So, and Levi, maybe you can speak to this a little clearer than I can, but I'll take a shot at it. My understanding is that their water shares are through GWISA, and the vast majority of the water they're using is not city water. Occasionally, in drought or in years they run out of water, they do use an old abandoned well of the cities. But is that right, Levi?
That is correct. We own the well. We own the rights to the well.
But
the
the
water rights.
majority of the time they're not using city water. Is that correct?
No. Yeah, that is correct. There was last year, the year before, they used it for most of the summer when they were having issues with the Kens Lake and the irrigation. Prior to
That was
that,
2 years ago, right?
Yeah. Yeah, and when they do use it, they pay us for it. They rent it from us.
So is that like a rate when we're discussing water rates that we have to make sure is updated?
The last time they used city water, I wasn't here, and so I would have to go back and research. My guess is they're just being hit as a commercial user. That would be my assumption. It's what I would do if someone walked in and said, "Well, this says you guys need to mutually agree to it." I'd say, "Well, then they need to just pay the commercial rate."
Okay.
So, but I don't know that that's the case, Ronnie. I'd have to look at that.
Okay. So in
Is
our
the bill
agreement,
metered to even be able to assess a fee for that water? It
Excuse me,
is?
Mayor.
Okay. Thanks, Levi.
and then we have references in both the old and the current agreement to financial statements and a review plus an annual report. And do we know if anyone historically was reviewing those? And can we at least get a review for the last year? I mean, I don't know about other people on council, but I'm not a golfer, but so my only involvement with the golf course has been knowing and appreciating that they do the youth program. And then Rebecca Davidson did a public works tour for us in 2016. But it just seemed like if we're, so if someone's aware of who's been looking at those and where they are, that'd be great. And if we aren't, before I sign any kind of agreement, I want to make sure we have some kind of plan for that so it doesn't fall through the cracks.
So basically, under the agreement, they have to come in January of each year and do that. From what I could see doing my research, that hadn't occurred since the early 2000s.
Okay.
But if we sign an agreement, and Lori can speak to this, Lori, now that we have Lori in-house, we track our agreements and we enforce our agreements. We are in the process of sending out a cure letter and an issue we were having with another contractor we're dealing with right now. So we're changing the culture of that here at the city. Contracts used to get signed and put away and then referenced when you needed them rather than followed and maintained. And we're changing that culture. And Lori is following and maintaining our contracts and staying up to par on them. And so if we sign this new agreement with them, it will go into the folder that our property management with Walnut Lane and others that we've signed, and it will get monitored and tracked as we go forward. And Lori monitors our contracts.
Okay, and then since we as council are being asked to sign this agreement, how and when is the lease or rent amount negotiated? And do we know if it historically remained the same? Are we talking about zero, or are we talking about $1, or was it probably more?
Historically, when they signed the last lease agreement in 2005, it was that paragraph 10 that said they paid 1.5% of their avenue revenue, 1.5% of their annual revenues. When they took that out in December of 2005, since that point, they have not paid the city for the rental. It's been basically a trade-off of they're maintaining the land and the water sources being protected, and they get to use it, and that's been historically used for over half a century. So
okay. And then would your advice to be, since the agreement says we can weigh in on green fees, be that once a year we at least ask what those are, understanding that you're saying municipal golf courses, don't tend to make money, but should we at least know what those are?
Oh, absolutely. I think every January it's completely to be expected and will happen. And we should require the golf course to come to city council and do a presentation of not just their green fees, but of their revenues, of their books, of their operations. They're required to provide us all of that for the use of the land. And I think that going forward, that should absolutely happen every January.
Okay. And
Is that
then,
something you would amend the lease to reflect, Joel?
It already requires it, is my understanding. Lori, is
So
that accurate?
enforcement of what's in the agreement, okay.
Yeah, and I looked in like in our record keeping, it even looks like in 2013, there was a resolution where the city council did go ahead and look at fees and adopt the fees. So, you know, trying to go back and piece together what we have done and haven't done. So that's something the council has done before, and I don't think there's any reason why you couldn't start doing that again.
No, and this contract is the epitome of the put it in a drawer and forget about it. It was signed on April 12, 2005. It had a term in it that the parties would agree to extend it by a period of 10 years in April 2015 by written notice one to the other. Like if anyone had been monitoring this contract and keeping tabs on it, they just would have wrote a letter. The contract would have got extended to, the lease would have got extended to 2025. And we wouldn't be having this discussion. I mean, it's the very epitome of everyone signed it, everyone put it in the drawer, and no one ever looked at it again once they got operating. And that's problematic. We can't do that.
okay. Well, then my other two main notes from stuff we talked about doing before we renewed it again was needing to just revisit where the water was coming from and leave a kind of help with that. Kyle, I mean, both historically and then as a member of the water board, I think with insight from that was saying, you know, you thought it was really important that we fully understand the management of the greens and what chemicals, fertilizers, and nitrates go on given groundwater, and make sure there's no groundwater contamination or interface, and check if herbicides are allowed. But and so I was curious if it's something where it makes sense to inquire with the drought board, or if there's any crossover there, because Kyle pointed out that Arnie does have a background in chemistry and soil analysis. And I did want to just make sure someone cross-checked our sustainability plan, because I can't remember, and I ran out of time and forgot to look if there's anything related to this in there. And that was it for me. I know Mike and Kaylin have items.
Do you want somebody to answer that regarding the sustainability plan and whether or not there's?
I mean, no one has to cross-check it right now, but it'd be good if someone did. But I mean, I don't, you know, if this over the years was one of the things that was felt like we just needed to better understand, I just want to make sure we're on top of this aspect and understand if we have enough knowledge on staff about those things, or if we need to ask Arnie.
Maybe that's something we should amend the agreement to contain, is that those reports have to be filed with the city annually as well, what's being used.
Well, I think the larger idea is that we should just understand, yeah, what's being used. And I don't know what our policy is about what can and can't be used, especially given the sustainability plan, but then also the bigger picture of, yeah, are we analyzing enough what's going on just to protect the watershed? And
Joel, do
So
you want
Ronnie,
to respond to that? Wait, hold on, Mike. Joel, do you want to respond to that as something that could be an amendment?
I mean, it's absolutely something we can do going forward. I'm kind of at a loss to some degree, because Levi is literally testing the water there for the last 20 plus years.
okay. Yeah, and I'm not
Hopefully-
a chemistry expert, so I don't know enough about herbicides, pesticides, and what we test for, or the test picking up those things. I understand radioactive stuff is probably separate, right? But I mean, I don't know all the standards we're supposed to. Do we have different standards on the watershed end for fertilizer? I'll let Mike take it.
Ken Calm, one of the phases of his report is to establish new water protection source zone boundaries. All right, and he's been working on this report for a long time. I don't know where it stands right now, but I know that's one of the things that he's supposed to report on. for what that's worth. So Ronnie, if you wanted to commission a special study about the golf course and all, you'd have to, and it's not in the bailiwick of what he was planning on doing anyway. It'd be a time-consuming, expensive process to hire a consultant to establish a pretty, very modest gain, if you will. I mean, in terms of.
Okay, so Kaylin, you had some questions, and then I would certainly entertain a motion.
Yeah, so just to follow up with that, at the last time we considered this in 2017, I looked into this and it seemed like that was the pesticide issue was my initial concern. And in my research, it sounds like just making sure that the people who are handling it are appropriately trained and qualified. And the greatest risk might be in spills at the storage point rather than the general use. But
Yeah.
I'm not an expert either. On to my other questions. Last year, I was under the impression we were moving forward with a PV array, photovoltaic array out there on 4 acres. Is that still in the works?
Carly, do you want to talk about that?
Yeah, and the mayor can talk about it too, because and Lori has also been participating in negotiations, and we've been in intense negotiations for about 6 months with Rocky Mountain Power, trying to come to some sort of meeting of the minds where we could somehow allow them to use our land and in exchange for some sort of adequate consideration. And a couple weeks ago, and we're working on a statement with Rocky Mountain Power to sort of explain the decision we made. We just found that under the proposal that Rocky Mountain Power was providing, we simply couldn't meet statutory requirements for public benefits to be achieved in order for us to lease that land. So just sort of simply put, the value that they were offering was not quite adequate to meet the value of the land that we had in mind for them to lease. As you can imagine, the golf course property is quite valuable. So the consideration that they would need to offer it was substantial. And the offer of the array at the water reclamation facility just couldn't cover it. So we worked for a long time to try to find an alternative, but they are limited in their ability to spend blue sky funds because of Public Service Commission regulations and their own regulations. So Mayor, I don't know if you have anything to add, and Lori, that's basically what the conclusion we came to.
Yeah, I would add that it simply wasn't the right fit for the Blue Sky project. And reminder that this project would have essentially provided land to Rocky Mountain Power to provide PV that would go back to Rocky Mountain Power. And so in the negotiations, the city was saying, there's a value to the land, and Rocky Mountain Power was like, we'd really like to, not pay for that. And there was really no value coming back to the city, and it was just a loss of land. And so the staff and Rocky Mountain Power were going back and forth. And I was just brought in at the very end when Deb was saying, it seems like it's just really not a good fit for the Blue Sky project. And so with Lori and Carly and Rocky Mountain Power, they moved forward with not pursuing the putting panels at the golf course. And what that essentially does is frees up that Blue Sky project for somebody else to participate.
Thanks for that update.
Yeah.
My one other comment is that it seems like section 1, which is the property description, has inconsistent formatting. And so I'd really like that to be cleaned up and for it to be mapped, just to make sure that everyone knows what is being leased before.
And I don't have an issue with that at all, Caitlin. That literally matches the legal descriptions in all the prior agreements. And when I was doing it, I thought the exact same thing, but we just kept it consistent with everything that had kind of went in the past. But I think it needs cleaned up as well.
And
Well,
Kaylin, I was just going to say, I think I have researched it a little bit, and I may know why. So the original 1959 lease just had those 3 parcels listed, and then Joel's right. It just, there was an option, it looks like, for there to be some additional land that could be exercised, and in the original 1959 lease agreement. And because of the age of the photocopy and the scanning, it's kind of hard to read the legal description on that option, but it looks like the golf course exercised that option for that additional land. And so then in the 2005 agreement that was added, and Joel's right, it looks like the formatting was just off from that point forward. And so I think that's why there isn't, you know, an alphabetic number to that last paragraph.
well,
But
I understand the reasons for the pass through, but I think this is important. I think it's important that
Yeah.
everyone understands what exactly they are getting the lease to, and because the city has a lot of land out there, and some of it's in use by the golf course and some of it isn't, and we might want to use it for something else and not have it encumbered by this lease. So I want it mapped. I want this cleaned up, and I want it mapped before I vote for it.
Okay.
Well, it seems to me that we've set up certain, that we're moving toward a list of certain revisions that we would want to see with the lease. So maybe we can quickly make that list, and perhaps we could move forward with a motion to approve pending these certain conditions.
We could make the changes and put it on the agenda for Friday when we have the.
So then I would entertain a motion to table until Friday, but I first think we should make the list of what should be on that, the revisions to that lease. Karen, you had your hand up, and Tawny, you had your hand up. Karen, you're muted. Sorry.
Don't be sorry. Okay, but so on item 11, I was just hoping that, you know, a financial review that we could elicit potentially Clint's expertise here, and to see if, I mean, we want to be looking at the 1.5% again. And it seems like, you know, sharing those documents, if the golf course can do that, then we can have a purview of.
So Karen, maybe, and I'll do it however you guys tell me to do it. The idea that I'm getting from them is that they have to do this because of COVID and the loss of funding and everything. So I'm going to jump off a cliff and say their argument's going to be, we definitely can't do it this year. That's the whole point of us coming and saying we need the leases. We got to get financing to get through where we're at right now. So what if we put in there that annually at the review, that it's, you know, something that's reviewed by the city, and you know, we word in there that that's reviewed at a 1 year mark or something. I don't know. I think we put it in there from go. It's an issue. Like, as soon as we put it in there, they're like, we can't do that. So we're just going to go right back to negotiating it. So I'm just trying to get.
Except the clause, Joel, the clause does say if they make a profit. And so they certainly wouldn't be at a profit this year. So they would essentially, if they're, you know, if they're in the red, they're not going to be reporting, you know, any percentage that would come back.
Okay.
Unless they take that profit and fold it back into improvements, and then we would just have to define that, support them to define that, right?
Yeah, I can do that. I can put that in there.
Clint, do you mind responding to that with your thoughts?
I can take a look at it at either point. I know we might be up against the wall at times, so I'll work with Joel and see what we can put together.
All right. So Tawny, yes.
I was just going to make a motion to table it until Friday with the caveat that we make a list of what we want cleaned up in it. That was not a very good motion.
Well, that was a great motion. The list I have right now is correction of the legal description, chemical list provided annually, financial review annually, a termination agreement or termination clause that we can clean up, They pay 1.5%, the original paragraph 10 and 11 review, if they're able to turn a profit. So some, go look at that original paragraphs 10, 11, and then word in how that works if they turn a profit, whatever that percentage was, something along those lines. And then a sustainability review. Did I miss anything?
As part of the legal description cleanup, I would like it to be put on a map. I don't need a formal survey. I think someone in
got it.
engineering could probably do
You
it.
want to see which parcels as an attachment?
Yeah, overlaying
Okay.
on a satellite image preferably.
Okay.
Mike, you had something?
Just one more thing for Levi. So if I got this right, the city you said the city owns this well. Do we pay for the pumping of the water? Do we essentially give them the water to irrigate the golf course with free? Is that correct?
So we lease, we charge them the water. They pay for the usage of they pay for the water itself. We
But
pay
Mike-
for the pumping, they pay for the water.
But Mike, the confusion is we only do that in years where they run out of their collective share with GWISA. So
Yes.
most years we don't provide them any water, nor do they pay
Yeah,
us for any water.
I heard him
Okay.
say that. So the only
Okay.
other thing, so Levi, is this water out of our well, which they only use from time to time, the same culinary water that the city's other two wells supply? I mean, it comes out of the same aquifer?
It is at the same aquifer, relatively.
Okay, so my question is, I know Chuck has been on our capital improvements list, a third well, a new well and so forth. I'm just looking ahead. I mean, if push comes to shove and the cities runs out of money and out of time and so forth, would we ever wish to take that well back, so to speak, and use it for a third city culinary water well?
So well number 7 is the one we're talking about, and it's ours. It's ours to take back right now. If I need to put it online tomorrow, I could do so for culinary purposes.
But Levi, my understanding, correct me if I'm wrong, is it's out of the same aquifer, but it's not a culinary well currently. We would have to refab the well in order for it to be brought into city service, correct?
Yes, it would take the labor of my crew to put it back online. It's physically disconnected from the culinary system.
Okay, well, I guess the only thing I'm trying to say, if we're going to renegotiate lease agreements anyway, to put some sort of opt out for the city if they decide we wanted that well for other purposes sooner or later. Of course, the golf course isn't going to like it, would be their doom. But if push comes to shove, it might be nice to have that option.
I don't know that it'd be their doom, Mike. I think 9 times out of 10 years, they're not using that well at all. I think it's just in emergencies that they're using it. And I think if it was an emergency year, we could have them tied in where they still pay us for water. I mean,
Okay.
Most years, it's not going to affect them.
I'll also go back and see what rate we charged them 2 summers ago during the drought. It was just the commercial rate or whatever.
Okay, thank you.
Okay, so I would entertain that motion, Tawny.
I move to table the golf course lease agreement until Friday, until the items that we have listed can be addressed.
Thank you. Is there a second?
Second.
Thank you, Kaylin. I will roll call vote without deliberation as it is a tabled item. Ronnie.
Aye.
Karen.
Aye.
Tawny.
Aye.
Kaylin.
Aye.
Mike.
Aye.
Motion passes 5-0. 9-4, proposed resolution 27, 2020, a resolution to award the contract for site planning, architectural and engineering services for Walnut Lane Apartments. I see that we have Caitlin available, joining us. Thanks for waiting in the wings, Caitlin. You are on mute. No, you are not. Welcome, Caitlin. 5-0. 9-4. Uh-oh.
Hi, sorry. Okay, so I am bringing forward the contract for site planning, architectural, and engineering services for Walnut Lane. And so this is kind of the conclusion of the RFP that we put out in December that closed in January. And I briefed you guys at the council retreat on March 6th, but we selected Architectural Squared, who's a local Moab firm, for this. And so over the last month and a half, we have been working with them to finalize a contract, and that is what we are presenting here today. So that's kind of a brief overview. I don't know if anyone has any questions or if we want to walk through any of that in particular.
What is the pleasure of this council? Do you have questions for Caitlin, or would somebody like to make a motion? Ronnie?
I just wanted to thank Caitlin because I had several questions that she already answered, and I'm happy to make a motion unless someone else has questions. Yeah. I move to approve resolution 27-2020, a resolution to award the contract for site planning, architectural, and engineering services for the Walnut Lane Apartments.
Thank you, Ronnie. Is there a second?
I will second.
Oh, Tawny had her hand up. I'll take Tawny's second. Discussion.
Caitlin, when are they going to get started?
I will figure that out with them tomorrow. We have had to readjust our schedule a couple of times. And I clarified this for Ronnie, but wanted to make a clarifying point just in this meeting that the schedule that we put in the contract is more general timelines for spring, summer, and fall of this next year. Spring, summer, fall, winter, spring. That will be working on the contract. And so we'll be working as a full team to break down what that looks week by week, but hopefully within the next, we'll get this signed, and hopefully within the next week or so, we'll start working.
Thank you.
Yeah.
Any other questions for Caitlin? Karen?
Sorry.
Oh, no. You just muted yourself.
Unmute. Okay. Going through everyone's resume, I mean, it looks very tight. It looks great. I'm curious. There was like the financial planner, like some of the descriptions of the work that it looks like Shikon Consulting's doing. Is that? It seems like that's sort of your purview. Like it's like the zone changes and variances and I'm just curious, like some of the preparing the applications, is that not your scope of the work?
Yeah, a lot of that still will be under my scope of work. And so that'll be something that Sheik and I will have to work out. And I think that some of that scope of work that he's included, I think part of that is he will be helping me. I think that he has, especially in terms of the financing piece, he has some contacts and will be helping me with some of the legwork with that. But we'll still need to figure out what that looks like. And so we tried to narrow some of that down, even moving from the bid proposal that is just a general description of work versus I asked him to break down his hours. And so I don't know on the architecture and the landscape architecture side what other items he's going to be helping them with. Yeah, I don't know if that answers.
I was just curious because it was like the third highest amount in the contract, and it seemed, identifying the property or, buying the property, like a lot of the stuff has already been accomplished through the city. And so it just was, I was just curious if that's a firm fee that, we're paying for that, or is that going to be so
his so that's part of the reason why I asked him to break down his hourly estimates of what he will be working on. That's like with all of the other team or all of the other firms that are on this team, that's like a not to exceed amount of the work that he's going to be performing. So if he ends up doing less than that, then the city won't be paying him that full amount, if that makes sense.
Yeah, I was just curious where your two descriptions collide, or, you know, coincided with one another.
Right.
So, but yeah, no, it's great. So exciting.
Yeah.
Other questions or comments?
I just want to tell Caitlin, thank you for putting this together. This was a lot of work and it's been a long time coming. So thank you.
Yeah, thank you. I'm really excited to get to work. It was kind of my goal to get to this point by the end of this month. And so we're just sneaking right in there. We're going to get to work this summer.
Good.
And it's very interesting too, as the city, you know, while it is our property and it is our project, it's a little complicated to also be the developer. And so I know that that is going to be, you know, roles and how you participate in the development is going to be something that there's not any precedent, at least for us in the city, to look to. So thanks for.
I want to tell Caitlin, thank you, and Barry and the staff as well. We really started trying to push this project in July of last year is when we kind of really started trying to clean it up. And it wasn't until September that we really started rolling, and we made a goal that we would be breaking and doing a lot of this by this spring. And so they've worked really hard to keep it on track, and especially Caitlin and Barry, and we have had our facilities crew that takes care of City Hall going down there and fixing everything that they can, you know, the swamp coolers. We've been putting ADU ramps on homes so people could use them and getting them all. It is crazy how much work has went into it just to get it to this point. So they've done an awesome job. The staff is just cannot be thanked enough for all they've done it down the Walnut Lane. And it has a long ways to go. Like, we're nowhere near satisfied with what we have. We're nowhere near satisfied with what's currently there and going to be there for the next year. So, but I just can't tell them thanks enough. It's overwhelming.
Yeah, I would ditto that. I saw Kelly at True Value today buying stuff to bring out to Walnut Lane. So yeah, we're working as hard as we can. I think that we're all really excited to be working on this project and are just taking it day by day to figure out how we're going to do it.
Yeah. Awesome. Gratitude to everyone. So let's see. Was there a motion?
Yeah.
And there was a second. So I will roll call this vote. Ronnie.
Aye.
Tawny.
Aye.
Kaylin.
Aye.
Mike.
Aye.
Karen.
Aye.
Motion passes 5-0. Thank you, Caitlin. Approval of the bills against the city of Moab. Donnie, is there a motion?
Can I just 1 minute before I jump off here? And first of all, say thank you, Mayor, for giving the shout out for the rent relief fund. We opened that application. And so if you know of people, we're going to be sending out a letter to Walnut Lane residents in particular, which is why I'm mentioning it now.
Oh.
Because we know that several of the residents haven't been working for months and will benefit from that. So anyway, if you want more information about that, feel free to reach out to me, and thank you so much.
Yeah, thanks for being part of the committee doing this overseeing the funds. Okay, bye, Caitlin. Approval of the bills against the city of Moab. Tawny, is there a motion?
There is a motion. I move to approve the bills in the amount of $169,000, $642.15.
Thank you, Tawny. Is there a second?
I'll second.
Thank you, Mike. Tawny, any discussion?
Well, everything was down a little bit this month, but I think staff has really worked, especially on buying local and not buying so much from Amazon. When I started, the bills to Amazon were upwards sometimes of $4,000. It was only 1,600 this time.
Good to hear. Good.
Good. Okay. I will call for the vote. Tawny,
Aye.
Karen,
Aye.
Mike,
Aye.
Kaylin,
Aye.
Ronnie.
Aye.
Motion passes 5-0, and we are at our adjournment. Is there a motion to adjourn?
So
I will-
moved.
Mike?
I was so moved, but before we adjourn, if I may, you guys have any idea what time Friday we might get together? Because I had some tentative travel plans Friday.
Oh, let's put that on the calendar now. Thanks for speaking up about that.
If we can come in our jammies, we can do it at 6, 7, 8.
That sounds good to me, actually.
Pajama party.
8 a.m.
I can do 8.
I can do 8.
I just want to confirm, are we talking about Friday the 1st or Friday the 8th?
Friday the 8th, right?
Yeah, I think the order expires on the 9th.
Okay, thanks. 8th's fine.
Friday. Oh, okay. Well, forgive me. I'm actually talking about this coming Friday. I thought that's what you guys were referring to. So I will withdraw my objections. We can set it anytime that you like.
Does anybody have any conflict on Friday the 8th at this time? Then let's just have it set up. Joel, pick the time. Carly, pick the time. You get to pick the time of what's most convenient for you and staff. Let us know.
Okay, we'll let you know. It's going to be like 8 or 9, sometime in the morning.
Perfect. Okay, now, motion to adjourn. Mike, you would like to make that motion to adjourn?
I will move to adjourn.
Thank you. Is there a second?
Second.
Thank you, Karen. All those in favor?
Aye.
Motion passes 5-0. Good night, everyone. Thank you for a great meeting.
Good
All right.
night.
Thank you
Bye.
all.